Let's talk about how every patient, I guess, that goes to your practice, you do a T-scan. What are the
Correct.
benefits for people? And a lot of your patients have a lot of symptoms, from migraines to ringing in their ears to imbalances. But why, if somebody feels pretty good, why do it for them? And what is it, and how does it work?
Sure. T-scan is a computer with a sensor, and you bite into it full max, and it gives me a distribution of force, and it talks about time, right? So there's a lot of data there. Okay. And the reason why it's important for patients to have this evaluation, it's the same as having an x-ray or having the probe depths, when they call out the 3, 2, 1, and they're checking the gums.
Yeah.
Well, you may not have any pain from that. That doesn't mean there's not a problem. That doesn't mean you don't have an awareness, right? Or you should be made aware that the dentist has some concerns. Now, whether you do anything about that or not, that's up to the patient. They get a vote. But a lot of times what we see is patients come in and they don't have any pain, but they'll have 35% of total bite will be on one tooth. Now, if you go to Vegas, you gamble. Now, if you knew that 35% of total bite force is on one tooth, would you lay down a bet that the one that's going to break or need a root canal is going to be the one that's overloaded? 100% yes.
So that's how people lose their teeth off at times.
That's how people a lot of times will break something. And they'll come in and say, oh, doc, I was just eating a piece of bread and this tooth broke. Well, it wasn't the bread that broke the tooth. It was the fact that this tooth has been overloaded for years and no one's known, right? Because the patient a lot of times we accept what it is and we get used to it.
Yeah.
It's there, that's the way it is, and I don't know any different. But if a dentist were to say, you know what, if you leave this untreated, what can happen is you can kill the nerve from repetitive strain injury on this tooth. Then you need what? Root canal. Well, if you need a root canal, then you also need a crown. Or if the tooth breaks and it can't be fixed, you're talking about a bridge, talking about an implant. So those are some pretty expensive.
So measure the bite force on every patient. Logically makes sense. Why isn't every dentist doing this?
That's a great question. I don't know.
But by the way, I was talking to an orthopedic surgeon, and he was saying that he scans people, certain patients, and just like you said, that one leg is like 20 or 30 pounds heavier than the other one, as far as the balance,
right,
which is going to cause back pain and everything else. Is it similar to this, where if one side of your mouth is taking all of 50% more force, it's going to cause early tooth loss?
It can,
and
or
migraines, and lead to all these other things?
Yeah, or just the regular dentistry that people get so frustrated with. It's like, oh, I've had a root canal on that tooth. I've had 3 root canals on the same tooth. Or I went in, my tooth broke, they put a crown in. Now the crown's broken in the exact same spot.
So excessive force can cause somebody to have a root canal?
Absolutely. You just kill the nerve.
Is that right?
Yeah.
Just extra pressure on that tooth.
Absolutely. Because the tooth is, where do the nerves come out on the tooth? At the very tip of the root, right? So that nerve is in compression. It's constantly being just pounded into the nerve and the blood supply. And once that goes, pain usually ensues.
So, okay, now you're missing a tooth, and now you have pressure on something else. Then it's just like a snowball?
Exactly. Now the pressure that was on that tooth, well, it went somewhere. And if you're not managing, you're just like, right, well, I had a tooth that broke over here, and then I had a tooth break over here, and like, I just have horrible teeth, doc. I just got stuff breaking all over the place. Like, well.
So if you are getting dentistry and it's breaking, pops off, or veneer pops off, it's because maybe they didn't measure or put your bite together properly the way your teeth come together? Is that your thought?
That is my thought, because we've done a test where like dentists can't identify those blue marks that tap, tap, tap on the paper or the shim stock or whatever they use to check the bite.
So the way they check the bite, typically, I've seen it like a blue piece of paper, you're tap, 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 and then they just look and see what's touching.
Yeah, and they try to, it's like reading tea leaves. They look at the intensity of the color that ink leaves on the teeth, or lack of color,
okay,
or the size of the mark versus a small mark.
So that's just old-fashioned in your opinion?
World War II, yeah.
So the T-scan is going to measure the actual bite forces?
T-scan is digital dentistry. It is the church of here and now. Absolutely.
Interesting. And so all dentists, I mean, it seems logical. I mean, what could an expert sit here and say, well, I don't know about that T-scan?
Yeah.
Could anybody poo-poo it?
Oh, they poo-poo it all the time. That doesn't mean they're right.
Okay.
It's always the people that don't own it, don't use it, never been trained on it, that all of a sudden are experts. Like, you don't need it. Right. Well, every time we run the test, and I do this at conferences, every time I run the test, I just have them vote. Okay, what's the highest mark? They get it wrong. And the patient suffers. If the dentists don't agree on what the treatment is, that means if you're a dentist and they come to see me, I adjust one tooth. If they come to see you, you adjust a different tooth. There's no continuity of care. If we're both looking at an x-ray and we've been trained...
So using computer technology,
yeah,
it takes the guesswork out.
Absolutely.
So if they took that away, you couldn't treat migraine headaches. You couldn't treat...
Oh my gosh,
these
I wouldn't want to. I wouldn't. Yeah, I wouldn't want to.
do it.
You couldn't do. Oh, I wouldn't want to even practice dentistry.
Really?
It's that bad, and it's that sensitive. And patients.
Less than 10% of dentists, you think, overall have this?
Oh, less than that.
Really?
Less than that. And even less than that are proficient with it. So one of the things you could do is, like, you can go on their website. Now, I don't get paid by the companies to say anything that I say.
Okay.
But if you want to find one of these doctors, you can go on the website, look for a directory, and look and find out if a doctor near you has one of these. But that doesn't mean they're proficient with it. And what do I mean by that? That means, like, just because I like Eddie Van Halen and I go out and buy a guitar doesn't mean that I somehow know how to play it.
Okay, so for example, you see, okay, that one tooth is taking 30% of the force. The next thing is, okay, what's the approach and philosophy with how we're going to correct this problem?
Absolutely.
Is that what you're talking about?
Yeah, you have to coach the patient. First of all, you have to get good data. Second of all, you have to interpret that data. Lastly, you have to turn that data into therapy. How are you going to fix the problem? Okay. Identifying is the first part, for sure.
You travel all over the country to learn this stuff?
All over the world.
Is that right?
Mm-hmm. I do.
And, I asked you in the green room what drives you. You say it's the happiest group of patients. When you could help them with their migraines or help them with their, stop that snowball of breaking teeth all the time.
It is. And, early on in my career, it was, oh, yes, I have 8 crowns to do today. It's going to be productive. Now I'm like, oh, I got 8 crowns to do today, And so, yes, these things need to be done to help people with just general dentistry across the board. These patients are always challenging. They're never boring. It's a puzzle. Every one is a puzzle, and you have to figure that out. And some people don't want the challenge, right? But these poor patients have been kicked around from doctor to dentist to specialist, and they aren't listened to. And it's so bad, even the patients' families are just sick of hearing about it.
Yeah.
Like, I look at you, I don't know if you're in pain. And so some of these diagnoses are made just by how patients present and what words they use to describe the pain. And they get classified or thrown into some other clump. And so to be able to offer a solution that's non-surgical is very rewarding.
And I know there's philosophies where I have these dentists that I've had on from Las Vegas. They have this like $60,000, $70,000 where they just crown every single tooth in the mouth to make the bite just right. That's not your philosophy and approach to doing this. So there's a better way in your opinion.
Absolutely. Look, there's a place for that, for sure. If somebody comes in and they're losing or they've lost a lot of enamel and you're looking into yellow teeth, that's the next layer.
So if they're worn off.
They're just worn off, right? There's a place for that. However, to make someone feel better, you can do ortho, but that usually takes like 2 years to complete, right? Okay. You can do a bite splint or some kind of orthotic, which is a piece of plastic. Okay, again, we're relying on the patient to be compliant with us for them to feel better, but you still have to take it out to eat, right? You can crown all the teeth. You can do joint surgery. You could do nothing, or you can do this and just adjust the teeth to where they fit. Now, most people, when I give them, those are all the choices you get. Most people are like, tell me again about that, by adjusting the bite thing.
Because it's about 90% less money, too, to get it done this way.
Yeah, absolutely. It's a fraction.
Is that right?
It's a fraction of full mouth, yeah. And it's a lot more conservative. There's less chair time. You don't ever get numb. There's not these series of appointments where you're...
But the main thing is they have to come in, they've got to get the scan, and then you could tell them what you think you could do.
Absolutely.